Hi, good morning, good afternoon, good evening, wherever you are in the world. A very warm welcome to Meet Menaca, episode 96. Today, we are going to discuss fertility preservation with Dr. Malini Uppal. Why are we talking about fertility preservation today? She is an expert in her own right. She's a medical director, Genet City Fertility, Farringdon, London. 1 in 7 couples are struggling to conceive. That is where the fertility professionals can help. And hence, we are talking about this subject today. And also to know, why is it a good idea to seek for assistance in good time? I'm told timing is crucial when it comes to fertility. So we are here today to guide you through the importance and raise awareness about this topic by discussing with the expert in the field, Dr. Malini Uppal. My limited knowledge from research is preserving your fertility could involve from freezing your eggs or sperms to embryos or reproductive tissues so that anyone can hopefully have a biological family in the future. It is common in people whose fertility is compromised. It could be due to health conditions or disease, or even when someone wishes to delay having children for personal reasons. You may also want to preserve your fertility if you wish to have children and are affected by any of these followings. A, as we already mentioned, age, if you're waiting to have children, but you may consider preserving your eggs or sperm before fertility declines, because you don't want to conceive at that particular time. It could be because of cancer, because that can affect a person's fertility. Autoimmune diseases, such as lupus and rheumatoid arthritis, and any other treatment for any of those things. And of course, reproductive health conditions like endometriosis or uterine fibroids, which is becoming more common, or we are definitely getting to know about them so much more. I'm glad that you have joined, not only listen to this discussion, but also to be part of an exclusive Q&A session with Dr. Malini, who will share her expertise on this field on an important subject. Now, a little about the show itself. The show was born to make a change and make a positive impact across the globe by bringing in experts who can share their wisdom and knowledge, and also bring speakers who are ordinary but have had extraordinary lives. So please support us by subscribing to the YouTube channel, Meet Menaca, so that we can widen the impact we create across the globe. And a huge thank you for people who have supported us so far. Now, back to the speaker. About the speaker, Dr. Malini Uppal has over 20 years of experience in the fertility and assisted reproduction field. As the medical director at Genet City Fertility, Dr. Uppal has been able to help hundreds of people go on to create families and or preserve their fertility. She has a special interest in polycystic ovarian syndrome, endometriosis, and repeated implantation failure. Dr. Uppal is also passionate about educating the younger generation about fertility and their options surrounding this topic. Dr. Uppal is a member of the British Fertility Society and associate member of Royal College of Obstetricians and Gynecologists. She is highly skilled in gynecological ultrasound and 3- and 4-dimensional scanning. So it is an honor to have you, Malini, on the show. The reason I call her by her first name is because I do know her for a while through a mutual friend. A very warm welcome to you, Malini, on the show.
Thank you, Menaca. Thank you so much. And thank you for such a lovely introduction. I am honored and I'm very pleased that I could be here on the show today with you. As you said, the show provides information, awareness to the people around the world. And I'm very keen and very interested for people to know more about fertility.
Thank you so much. It's a pleasure having you, Malini. So let's dive deep into the subject itself. So as an expert, what can you tell us about fertility? For example, what is fertility? Because I know your journey has been from obs and gynae to a world-class fertility expert. So how can you explain to a layman what is fertility and why is it important?
So fertility is being able to conceive and have a child. So basically that's what fertility is. Why is it important for anyone to be aware? I think, according to me, awareness is the most important thing. And why is it important for anybody to be aware about themselves is because fertility declines, whether it is man or woman, it declines with age. So if you are not aware about yourself, about the fertility, about the biology of the body, at the right time, and you're not able to make the decisions at the right time, then you may make it more difficult for yourself and may lose the opportunity to have a child of your own, with your biological child. So that's why it's important for everyone to be aware of what is their fertility status and what they can do and prioritize things accordingly, because it's, as I said, with age, the fertility will decline and there would be a point that you might not be able to do anything biologically to have a family.
Thank you so much, Malini, because I think it's really important, first of all, for people to understand what it is and why it is important to have a knowledge about this. So thank you so much for that. You said that fertility is to be the ability to have a biological child. So how do you think a man and woman's fertility has changed over the last 15 to 20 years?
As we are now we are now in a generation, in an era where women are doing more things, more in their careers, more studying, more educating themselves, more professionally, they are doing more. So back in the days, a woman used to get married, have children, have family, and that's the end of, everything. These days, the scenario has changed, the scene has changed, and more power to women. I believe that everybody, whatever gender they are, have the right to do whatever they want in life, whether it is about traveling more or learning more or giving themselves time in whatever different way they want to do. And because of that, because of higher education, more education, because of more career progressions, there is a delay. So the average age of a woman to become a mother has now moved from 20s to 30s now. So the people are delaying starting their family because they want to do something before in their life, before considering starting a family. And that is a change, that's a major change that we've seen in the fertility scene, is having children later in the age. Having children later in the age means that you could then again, end up having more challenging times, more challenges to overcome to start that family.
Thank you so much, Malini. It's I guess you are trying to help them to be able to have the choice to have a child if they choose to have it later, and also, like we already discussed, I think many other things can take that choice out of them if they don't have this assistance. Am I right in saying that?
That's correct. Yes.
Sure. Thank you so much. So what are the changes you have noticed in this journey? Because you have gone from gynae obstetrics to this. So has the lifestyle itself, other than the choices we make, has the lifestyle itself, has it affected fertility?
Yes, because I think, as much as we say, the stressful life that we are leading these days, so as much as it is an abstract thing to say, does stress affect having a child? Just the the amount. So again, if we go back into our working lives, job profiles, people are traveling so much. Partners working elsewhere, she's working elsewhere, partner is working elsewhere. They don't have times, or the longer hours of work, the stress related to work, they're working all the time. They don't have that kind of time for each other, and that, you know, that they are having intercourse or enough intercourse at the right time to actually be able to conceive. So these kind of changes is our new modern life that's giving us. Our education is giving us, because we work long hours. If you're working long hours, we were so tired by the end of the day. The last thing you can think is, oh, fine, no, all I want is just my bed. I just want to sleep. I don't want to do anything. So that is making, again, it's become challenging for couples to find time for each other, to try. So are they trying enough these days? Probably. I think the first question I asked my couple, what is the frequency of intercourse? Are you actually having enough intercourse? Do you have time, you know, that you can do it at the right times to try? So that kind of change is certainly, you know, noticeable these days that we see. And of course, heavy smoking, people who drink heavily, fast food, not eating healthy food. You're so busy in life, you just pick up something from somewhere, not eating healthy food. Then those kind of things are also, you know, they impact your fertility. So having a restful sleep, to having good food, a nutritional rich diet, to having, you know, being a non-smoker. I would never say don't drink, but I would say drink sensibly and, you know, in limits. These are very important things, but there are lots of people who don't care about these things. A lot of people, the lifestyle is so bad that this will then definitely, smoking is one of the things that has been established that will affect the sperm as well as the egg quality. So these are the things to be aware of, that this can affect your fertility.
Just out of interest as a layman, does obesity affect fertility at all?
Yes, obesity has been shown to actually have decreased egg quality. It decreases your egg quality also, as well as the sperm quality. So that's why being in your normal BMI is very, very important. Again, obesity not only decreases fertility, but then also increases a lot of comorbidities. That means when you are pregnant, you are then, if you're obese, and you're at a higher risk of having gestational diabetes, hypertension, you know, infections, preterm labor. All that is, again, we become a higher risk patient. So being in your normal BMI, and that's why I'm stressing, and having a healthy diet, incorporating exercise in your lifestyle, these are very important things to consider.
Thank you so much. These days, nothing goes past COVID. And again, at least in the UK, we know now the COVID rates are going up again. Can you tell, as an expert, how has COVID affected fertility?
So what has COVID done to us? COVID locked us into our houses, right? We stopped going out, we stopped socializing, and back to the couples who actually are not having time for each other because they're working so long hours and away, and then they have to do their social commitments and everything as well. Now they're all there in the house together 24/7. So what did that do? That made them think, talk, think about themselves, look around themselves, see, right, oh my God, I didn't realize I was 35 years old. The life is just going on, the clock goes on, the years change. You don't realize it's the only thing you realize is as I've gone from one position to another, to this post to that post. And then, you don't realize, or we have to buy a house, do a mortgage, and do this and do that. But then this made them actually realize, right, maybe this is the right time to actually start trying, think about family, because we are at the age. So I've seen during this COVID time, actually more couples came to us to talk about fertility, to find out their fertility status, to know about what is a woman's egg reserve and what is the sperm parameter for the man. And if they have tried for that many months and they've not been pregnant, which is to their surprise, because most of the time we are told, every girl, every woman, is told, don't get pregnant, don't get pregnant, take pills, don't get pregnant, be careful, don't get pregnant. And then, so it's so much in the mind, that's what we're told all the time, that, oh, they think, okay, the minute we will stop the pills, we're going to get pregnant, because that's what we were told, that, be careful. But when these couples, then you've stopped the pill, you have now started trying, you were in COVID, you were in lockdown, you were actually, there was no stress of traveling, you were eating healthy food at home because you're not eating outside, restaurants are closed down, so there's nothing. You are more concentrating on your health, you actually think about yourself. And if they have not gotten pregnant, that comes as a shock to them, that comes as a worry. There's been more young couples who've actually come to us seeking help because they have now actually tried and realized that it's not happening. So I think COVID, in a lot of ways, obviously as bad it has been, but has a lot of ways done good to people who were seeking to start a family, because they have done so. They have, if they needed help, they've come find out their status, and lots more couples are now aware because they gave times to themselves.
Thank you, Mali. I think it is true in many aspects of life for people, as you exactly said to the point. Everyone has been so busy in their hamster lifestyle. We often forget what is important to us and what we want to be, what we want to become, and maybe having kids, career change, everything else in between. So I think this has definitely given an opportunity. We were forced to press the pause button, whether we liked it or not. But I think a lot of people have actually been more aware of themselves and their surroundings and what they want during this COVID. And I'm positive one of it, as you said, the knowledge that it is not a just switch off on button and you're going to conceive, and it is a bit more than that. And at least it's good news, I guess. They are seeking advice and finding out what are their chances to conceive.
Yes,
and
absolutely.
Thanks, Mani. So now, with changing lifestyle, how is egg freezing helping younger working women? Because I agree, and you also mentioned that that is an issue with people who are career-minded. There's nothing wrong. Men and women have the equal rights to do whatever they please with their lives, right? How can you help? How is the egg freezing helping younger working women today?
So I would recommend. As I said, the fertility declines with age. So it's there is two things: is quantity and quality. Both of them decline. So the quality even of the eggs that we've got, something that we were born with, starts declining in 30s. More after 35, 37, and a lot more after 40. So I would say for any woman, and to take that pressure off, to stop thinking about your biological clock, to stop, to do what you want to do in your life, to have that option, come and do your egg freezing, because it's very, very important. If you freeze your eggs in your early 30s or late 20s or early 30s, and you don't want to start a family, you don't want to have a child, you're not in that space at the moment, there's enough egg freezing done now. We've now got enough babies born from frozen eggs, that this is no more experimental thing. It is now a very well established technique of vitrification, which is now what we do as a quick freezing, fast freezing of the eggs. So anybody who is in their 30s, late 20s, 30s, you should consider doing egg freezing, because that's going to take that pressure off your mind. You could be using those eggs. You might get pregnant first time naturally once you start trying, when you're ready, whenever you're ready. you might use this eggs for your second child. So it's not that, you know, that you won't be able to conceive naturally after this. I see so many women who would come and say, well, we always thought about it, but we thought we'll do it next year, and then next year. And then, oh, we thought they're single at the moment, they don't have the right person. You don't have to push yourself to you know, find someone just because you think now you're going older and you're going to lose your chance or your fertility is declining. Freeze your eggs. Don't start a bad relationship. Freeze your eggs. Take your time. Find the right one. Find the right person in your life. But at least this will take the pressure off your somebody. Even, you know, obviously egg freezing is done for medical reasons as well. People, women who are having cancer, treating, you know, having treatments, chemotherapy, so to preserve their fertility. This is something that's done by NHS to preserve the fertility. Women who are in high risk jobs, you could be working in armed forces, you know, or something where you feel that there could be an injury that can lead to loss of your fertility. Freeze your eggs there. There are people who are, you know, transgenders who want to change their sex and looking into transitioning into a different gender. Both who were assigned male or female at birth but want to change, they should freeze their egg or sperm, whatever, to preserve the fertility so that they still have option of having a biological child in future. So all these people should be aware that freezing eggs, freezing sperm is now a very good option that that you should consider and actively consider. Don't wait for tomorrow and the next year and the next year. The earlier you do it, the better eggs you will have, or better sperm that you will be freezing.
Thank you so much. I was listening to you. It is not that you will have to use it, but in case it's like taking insurance policy, I take it, particularly in certain circumstances for people, to ensure that you will have the choice if that comes to pass. Is that correct, Malini?
Correct.
So thank you so much. So now we have spoken about women, but men are often left behind, or we don't talk about it often, right? So let's talk about sperm freezing and how age affects the quantity or the quality, rather, in men.
Back in the days, it was always thought men fertility never declines. You know, they are able to have children whatever time in life. But I would say the couples that I see, at least 40% of the cases are due to men having some issues with the sperm. And now more and more evidence is coming out that even the sperm quality declines with the age, starting from 40s and a lot after 50s. Older men, the children born from older men or older sperm are seen to have more associated mutations and anomalies, which is now seen to be linked to more about the sperm rather than the egg. So it is now, it's not that you're forever fertile. Men still will produce sperm, you know, throughout their life, they do, but the quality of the sperm also declines. So even for men, I would say, again, lifestyle, very important. Smoking affects your sperm quality. Very tight clothing, anything that produces heat to the local area. You know, too much of exercising, too much, when I mean, everybody should exercise and must exercise, but too much, I mean, when you're doing really excessive weightlifting or excessive amount of cycling, where you're wearing very tight cycling shorts and you're cycling, that increase, all this can affect your sperm. So, and again, men who are wanting to transition and going through transitioning, then they should also consider freezing sperm for future biological children. Men I'm just trying to think who else, I mean, as a category in men who should be, again, high risk jobs if they are in armed forces and things, they should. Also, I would say men who are considering to have vasectomy, they think that they've had family, they've completed family, and they're actually going for their tubal ligations or vasectomy. Though I'm seeing quite a lot of men coming who've had vasectomy done, and then if they meet someone else, and if you have a new partner, then we end up taking out sperm from the testicles. So maybe it is a good idea to actually freeze some sperm before you have vasectomy, preserve that fertility. You never know when you would want to use it, and then have your surgery.
Thank you so much. I totally agree. From television dramas to cinema, thanks to everything, there's a common belief, at least in the past, that if there's a problem with fertility, it's always the women, isn't it? So thank you so much for talking about it. And I think it's so important, first of all, for the advantage of men to understand that they have to look after their health and their well-being, and there's a chance that there might be a problem, but also for in general, as a society, for us to know that it is equally important for men and women to consider these things. So thank you so much, Malini. I know people who have had 1 or 2 IVFs, and I do know a couple who have had 3 IVFs and failed. So will you be prepared to do something for those people who are with multiple failed IVFs?
Yes, absolutely. So IVF, going to IVF is a tough, it's a tough journey. It's a very emotionally taxing, demanding in all sorts of ways, because there's a lot of hope that is attached to every cycle that we do for our couples, right? And then, yes, not every couple would be successful in the first or the second cycle, because it is such a multifactorial thing. We think that we know a lot, but there's so much we don't know still. So the reasons could start from, we have to see why the cycle has not been successful. And there are additional tests, there are further testing that we can do. And it'll depend on the couple, it'll depend on the age of the couple as well. And then why they've had a failed cycle. We do look into the whole picture and then decide what further testing and everything will be advisable to them. And then yes, I have patients who have had who've done multiple cycles, either with us or elsewhere. But then there is still light at the end of the tunnel. We still have the hope, and there are things that we can do. Unfortunately, there are points that when we feel that we've done everything that we can, and again, every cycle is so taxing, when you go through it emotionally, I would say it's so taxing, that there are some points where we have to tell the couples that, instead of having a cycle with your own eggs or sperm, it will be better if we use a donor egg or a donor sperm, and that is going to give you the results, the outcome that we are hoping for. So yes, sometimes we have to say that as well. And the couple, even though it might take time for anyone to accept this, but then when they do it and they're happy, once they have the baby, they're very happy. Forget about where the egg came from or where the sperm came from. It is the baby that they have eventually in their arms, and they're happy with that.
Thank you so much. When you talked about the multifactorial aspect, there's also the financial aspect, right? Because I know NHS does help, but there's, as far as my limited knowledge goes, there's a certain number of attempts which are allowed under NHS. And then some people go abroad, I know people who have gone abroad and got it done, some people who get it done here. And the stress of it, including the financial stress, it's massive. Why would you then recommend someone to, first sort out to IVF, or is there anything else around that area that people should know, Mali? Because like you said, it is a very demanding process. So what should people consider before that?
So as I said, right age, right time. So when woman is younger than 35 and a couple starts trying, that couple should try for 1 whole year of having regular unprotected intercourse before considering anything. Okay. And around 85% of couple who are to get pregnant will get pregnant in that 1 year. Okay. And if the woman is over 35, again, it is because the fertility declines not only in quality, also quantity. After 35, the recommendation is to try for 6 months of having unprotected intercourse, regular unprotected intercourse. And if you're not pregnant, then you should seek help. Now, once this couple comes to us and they want to, or they go to their GP and NHS, whichever way. Unfortunately, NHS is limited its funding for fertility a lot, and especially during COVID, it was all taken away because this is not considered. At that point, everything was going to COVID, all the money was redeployed to COVID, and fertility treatment actually stopped in NHS. And people had to come privately to do this then. So when this couple comes to us, we first thing again is assessment of the female ovarian reserve. So we do a scan, we do a blood test of what we call as anti-Müllerian hormone, AMH, and a semen assessment for the partner. Okay. Once we have those results, based on that, if it is a good result and everything looks fine, we would also advise to do a tubal patency test to check the fallopian tubes of the woman, to make sure that the fallopian tubes are fine, because that plays a central role in natural pregnancy. Once all this is established, these are the basic first step tests. Based on that, if the tubes are open, sperm is fine, then they have the option of doing either IUI, which is intrauterine insemination. IVF is the last step. So we do beginning with lesser invasive, milder treatments. We do offer that. Again, it'll depend on the profile of the patient. If someone is 38, 39 years old, when the woman is that age, I would think maybe IUI might be a little waste of time, because the chances of success doing IUI, which is intrauterine insemination, is much lower than IVF. So depending on the patient profile, they will be recommended both treatment, explained about both the treatments, and then we will advise which one we would advise you to have. But obviously, final choice with all the information is patient's choice. And IUI is less invasive. It just involves either based on the natural cycle or taking some tablets and preparing the sperm in the lab, concentrating and putting it inside the woman's womb. So it depends again on the patient. If we find the tubes are blocked, then IUI is not an option. Then we have to go ahead and do IVF.
Thank you so much, Malini. It's very, very comprehensive. So thank you so much, because there might be a lot of people who are interested in doing these things, and perhaps it is useful for them to know what are their options, what they should consider before. Because I think because now you have said that so many different options are there, perhaps more people will be able to explore this journey and see where they stand, rather than not knowing. Not knowing is the place we don't want to be. Isn't it? That is the point, I guess. Thank you so much. So, as an expert, what would you recommend to someone who is not prepared to have a child, might be even 20s, 30s and over?
So yes, as I was telling earlier, that fertility preservation, this is our topic today. For anyone who's not prepared to have a child, not in a right relationship at the moment, doesn't have, or want to go and travel the world before having a child, or want to study more before having a child. If you are a female, please consider freezing your eggs. And if you're a man, and if you are, going 40 and above, then maybe freezing some sperm will be also a good idea. So if you have to go through any sort of medical treatments that might involve, or you're taking some medication that might affect your fertility, please consider freezing eggs beforehand, or sperm beforehand. Patients with younger patients with severe endometriosis, now something that is considered now, more and more evidence is coming, can affect fertility, should also consider freezing eggs at a younger age than leaving it for later.
Thank you so much, man. I think that's really important to know as well. I think we touched upon it already. So when we think of fertility, we normally always think of females or women in general. And what is your view on that?
Yes, as we said that, I still, get sometimes women who are coming for their fertility assessment only. And I ask, where is your partner? Well, why have you not got your partner with you? Oh, no, because I want to check first mine, because I might have a problem. And we have to overcome that. We have to overcome, man and a woman are both together, equally in making this. So sperm has got an equally important role in creating a child as the egg. So both of them need to be tested. You both need to get checked, and you both need to come and get your assessment done. And as I said, that previous belief that men will remain fertile throughout their life is no more there, because the quality of the sperm also declines. So age for even men is important. It might not be as crucial as a woman, but it's still important to look into that. It's hand in hand. You can't separate the two. So it is equally important to assess males as much as females.
Thanks. It's not only about age, right? There could be other factors in either sperm quality or the woman. I think the best advice what you gave is, if both of you want to have a child together, then both of you are in it and go and get the test done together as well. Isn't that right, Mal? It looks and it seems very obvious, but obviously we don't practice it. It's far from perfect world.
Yeah, even now I think that we're not doing that. I mean, as a society have grown a lot. I think as a culture, as a society, we are now. I think there is a lot more. In general, if I talk about fertility, there are changes in the fertility scene that we see. A lot more, we're treating a lot more same-sex couples, gay couples, lesbians, transgenders, and there's a lot of acceptance and a lot of surrogacy. Surrogacy is coming as acceptance, because those gay men who want a child, they have a right to have a child. So then surrogacy becoming more acceptable and more, talked about thing and more open in these days is helping those couples. So it's not only now heterosexual couples. There are other people, other patients that we've got, non-binary, transgenders, lesbians, gays. Everybody has the right. Everybody has a right to have a child. And I think knowing about yourself, knowing about your choices, knowing about what options you have is very, very important.
Thank you so much, Malini. So I know you have a daughter personally, but what would your advice be to your own son or daughter?
So, this becomes this thing. I keep telling my daughter, okay, you obviously, first thing is to try naturally that you would want, but I don't want to push my daughter to start a family just because I am in fertility and I know fertility will decline and I will become paranoid mother to say, right, have a child, otherwise there's going to be a problem. But I'm already 100% sure that I will be advising her to freeze eggs. I've already decided her 30th birthday present will be egg freezing. Yeah, she won't be very happy with that, but yeah, I think freezing, preserving your fertility, having the freedom, having that option, having the choice is what I want her to have. I want her to do whatever she wants to do in her life, and this should not be pressurizing her. Unfortunately, this is how our body is made. It will run out, this will happen. But fortunately, we have advanced so much that we can actually do something about it. And when we can do something about it, then why not? So my advice to my daughter, my son, will be, freezing. Preserve your fertility at the right time so that then you don't worry. Do whatever you want in your life. And then you've got the whole world to yourself.
Thank you, Malini. And I know the person I know you are, I'm sure that is going to happen as well. You'll make sure that, gift is given, provided it's along with something else. I'm sure she will have no objections either. So thank you so much. Thank you so much, Malini, for that. We have spoken a lot about fertility, how we can preserve fertility and why it's important. We have covered a lot. Can you tell our audience or the viewers the 5 must remember? Because we have covered a lot, and it is really challenging to remember every single thing what we have said. Of course, this part of the talk show will be on YouTube. Please do go and listen and view it and see what you missed out. But if you want to just say or share 5 tips, what will they be?
So my advice would be, first is a healthy lifestyle for everyone. It is very important, everything that we eat, everything that we do, having a good sleep, having a very healthy lifestyle. I'm not the person who would say, don't enjoy yourself. Please do, have fun, do everything that you want. If you're drinking, you have alcohol, but have at least 2 or 3 days alcohol free in a week. Drink within your normal limits. I would say that smoking is something I would totally advise against, that, smoking does affect your fertility, your eggs, your sperm a lot. So please don't smoke. And I would say, again, as I said, having a good sleep, exercise, a moderate amount of exercise, staying in your normal BMI is essential lifestyle skills that you should be doing if you are preparing yourself to have a family in future. So this is important for that. And then know about yourself, have a fertility check done. There is no harm in just having the information. There's no harm having just a check. So come and have your fertility assessment done. We at our clinic at Gannett City Fertility do half an hour free consultation as well. So you could be someone who wants a little bit of advice, happy to talk to you. It's a free consultation that you get for half an hour. Happy to answer your question, introduce ourselves in our clinic. But find out about your status, find about your fertility status, what it is right now. Knowledge is power. Have the knowledge about yourself. Then if you are someone, again, who wants to postpone starting a family, do fertility preservation, freeze eggs, freeze sperm at the right time. The earlier you do it, the better results you will get. Or if you are somebody who has been trying already, and if you are over 35 as a couple, and a woman is over 35, you've tried for more than 6 months, please again come and seek some advice. If you are under 35, if you've tried for 1 whole year and you are not being successful so far, please come and seek some advice. As I was mentioning earlier, again at City Fertility, we do have an hour free consultation. So yeah, please come and book that whenever, and we'll be there to help you.
Thank you so much, Malini, because I think it is really important, and it's great to know that you have half an hour free consultation. So, if I come across someone, I'm definitely going to send them your way too. So thank you so much. What has been your experience on the talk show?
I actually really enjoyed. I have enjoyed the show. Again, as I'm saying, knowledge is power, and I believe the more awareness we can spread, the more knowledge we can give to people around. It's priceless, and this platform that you have created is invaluable for spreading the word across and to spread the knowledge around about things that are important in life. So I really enjoyed myself here, and you're doing a great job.
Thank you so much, man. Very, very generous comment there. Thank you so much for that. What will I be taking away from your talk is two things: knowledge and choice. Have all the knowledge you can accumulate. Please feel free to go and learn. And, Malini even said there's a 30 minutes free. So it is a really great thing. And also make sure you always have the choice. I think that was the two takeaways. I am going to take it personally. Thank you so much, Malini. It was very, very informative. For people who are on the Zoom, please hold on, and even people who are on the Facebook, because we will be, people who are on the Zoom will be given the chance to have exclusive Q&A with Malini. So please hold on. Now, following tradition, I'm going to announce the next episode. Our episode 57 will be about modern keyhole surgery with Mr. Kunasingam. He's a consultant orthopedic surgeon specializing in foot and ankle conditions at Shearn Clinic, London. Mr. Kunasingam graduated in medicine and surgery from Guy's and St. Thomas Hospital with a Bachelor's of Science in Experimental Pathology and Genetics. He initially taught anatomy under Professor Harold Ellis at Guy's, King's and St. Thomas Medical School. I think a lot of the people who are from the medical background will know who it is, whilst training in general surgery and orthopedics within the London Deanery and Southeast Thames rotation, and now helps with training there. Mr. Kunasingam underwent subspecialty training in foot and ankle surgery in Sydney, Australia, which included minimally invasive, that is keyhole techniques. Whilst in Sydney, he was involved in the treatment of elite athletes as well. So we will go about him a bit further in the next episode. But really looking forward to him coming and talking about, because keyhole surgery is becoming one of those things we come across all the time. Thank you so much, Malini. Now over to Dr. Kanta Niranjan to give the vote of thanks.
On behalf of Meet Menaca team, I have great pleasure. It's a wonderful talk by Dr. Malini Uppal, Medical Director of City Fertility, Farringdon. It is a very informative and very clear talk for anyone. This topic has given a lot of knowledge, which we all should have, I think. It's even though whether we are in any field of our speciality, it is a day-to-day life in our life, producing children, our niece, nephew, various people marry, talk. And so it is, you have given a very good information today, Malini, which is very good. I already have 3 grandchildren, but I have a son waiting to start a family. So you have given a very good information, my niece, nephews, anyone. It is very, very important, because personally, I know someone who had, after first marriage with 2 children, had vasectomy done, but later divorced, but wanted to married again, wanted to have a child. And we found very upset that he didn't save his sperm before vasectomy. I come from Sri Lanka. We have so many people who undergo vasectomy and things like that, but never think this. But here, even there, here this has happened. So thank you very much for a very good talk. And definitely we'll have some questions to ask. Can I ask the first question? I'm a geriatrician. I'm a care of the elderly physician. I know women, when they get menopause, they stop producing children. And you mentioned men continue for a long time. In your experience, up to what age you have found a man has become a father? I thought up to 70 or 72, but not beyond that. Just that's a simple question I'm asking.
Normally we don't allow questions, but yes, because Kanta has already asked. Yeah, let's get this question out of our.
Start the talk of it. Yeah.
Yeah. Sure.
I do get men in 50s and 60s in my clinic who come and have had children using their own sperm.
I know somebody had at age 70, I must say.
Yeah, 70, yes. It's up to 70, I know. I don't know after that, but biologically, even up to 80, they can be producing good enough sperm to have a child.
Oh, it's okay. Even sometime for biologically saving sperm, if you want to have a biological, your own genetic thing, you think you can. But you mentioned when you age, the health of the sperm goes down as well, isn't it?
Yes.
Thank you very much.
So it definitely won't be recommended to use a sperm for someone who's that old, because even it might be able to fertilize an egg and create a pregnancy. It's more than related, than, leads to miscarriages and babies with issues. So it won't be recommended to be, fathering a child at that age.
Thank you, Kanta, and thank you, Malini. I guess it is the exception than the norm, perhaps. So thank you so much. That's okay. So thank you so much for that. And for people who are on the Facebook, a huge thank you for supporting us week after week. It has come to that time of the day to say goodbye. Same time, same place. Next week, we will be talking about modern keyhole surgery with Mr. Konasingham in episode 57. Till we see you next week, stay safe, be happy, and keep smiling.